Welcome to this explainer. Today, we are setting the stage for a truly fascinating comparison between two incredibly high-stakes, highly complex environments. We're talking about military aviation and healthcare. We are going to look really closely at how the Royal Air Force and the National Health Service approach safety, and specifically how they've navigated the incredibly difficult journey from a culture of blame to a culture of disciplined learning. If you've ever wondered how massive, complex organizations handle life and death mistakes, you're absolutely in the right place. Let's get started. Okay, let's dive into this. Does a safe workplace actually mean that nobody ever gets blamed for anything? Well, it's a super common misconception that improving safety means you just have to let everyone off the hook when things go wrong. People often think that creating a safe space for reporting errors means removing consequences entirely. But as we're going to see today through the lens of our source material, that couldn't be further from the truth. To really wrap our heads around this, let's look at the two extremes. On one side, we have blame culture. This is an environment where people literally hide their errors out of fear. And think about it. If the primary goal of an organization is just to find a scapegoat, they lose all the vital information they need to actually improve safety. But on the complete opposite side of the spectrum, we have a blame-free culture. This is an environment with zero accountability, even for completely reckless behavior. And honestly, this is equally dangerous, because organizations that never hold people accountable completely undermine any trust in fairness or organizational justice. Ultimately, both of these extremes completely fail to protect patients, and they fail to protect staff. So where's the sweet spot? Well, a true just culture sits perfectly in the middle. It's a system that protects learning from fear while making accountability much clearer, fairer, and far more consistent. See, the goal isn't to eliminate accountability. The goal is to ensure the organization responds to incidents in a predictable, proportionate way. It treats genuine, honest errors very differently from deliberate wrongdoing or willful violations. Here is our roadmap for today's explainer. We'll start with the just culture myth, then explore aviation's hard-learned lessons, follow the NHS safety journey, compare where the two differ, and finally, look at applying these lessons directly to healthcare. Part 1. The just culture myth and why accountability still matters. Just culture is often incorrectly thought of as a sort of get-out-of-jail-free card, but this really powerful quote from our source material cuts right to the heart of it. Mistakes are often symptoms of wider organizational conditions rather than individual failings. This right here is the central insight of a just culture. When an organization hunts for a single person to blame, they're effectively putting blinders on. They blind themselves to the real, systemic risks, things like poor processes, bad system design, or inadequate training that actually set that person up to fail in the very first place. However, and this is a big however, while maintaining a systemic focus is absolutely crucial, a mature organization just cannot ignore individual conduct entirely. You have to draw a hard line between a genuine error and reckless behavior. If someone makes an honest mistake because the system is flawed, well, they need support and the system needs fixing. But if someone engages in deliberate misconduct, a mature organization has to maintain trust by holding that behavior accountable. That is exactly what keeps the culture just. Section 2. Aviation's hard-learned lessons and the RAF's turning point. So aviation reached this realization first because, quite simply, they had to. The consequences of failure in the air are just immediate, and they are severe. For the Royal Air Force, the defining catalyst for change was an absolute tragedy. It was the loss of the Nimrod XV-230 in Afghanistan back in 2006. The subsequent review of this disaster exposed some incredibly difficult truths. The tragedy was not caused by the actions of individual aircrew. Instead, it reflected deep, systemic organizational failings. It exposed severe weaknesses in leadership, in safety culture, in assurance, and in risk management. The fault was completely baked into the system itself. In response to that tragedy, the RAF completely reshaped their military aviation safety framework. They introduced independent regulation, mandatory occurrence reporting, and highly structured investigations. But most importantly, they made behavioral accountability an explicit part of the system. And this brilliantly illustrates how they evolved. What this means in practice is that they separate fact-finding from judgment. Investigations focus entirely on understanding what happened to prevent it from ever happening again. Decisions about accountability, those are only considered after the facts are completely understood. Section 3. The NHS Safety Journey, a Parallel Evolution. Shifting gears over to healthcare, the NHS has been on a remarkably similar journey to protect its patients and its staff from systemic failures. As we walk through this timeline, you can clearly see how the NHS has evolved. Back in the year 2000, a report called An Organization with a Memory highlighted the desperate need for openness, reporting, and actual organizational learning in healthcare. Over the years, this evolved into national reporting systems, and by 2018, the Just Culture Guide. Today, the NHS is implementing highly structured, modern frameworks like the Patient Safety Incident Response Framework, or PSIRF, and Learn from Patient Safety Events, or LFPSE. Today's NHS patient safety approach heavily emphasizes learning, human factors, and fair treatment, fully recognizing that most incidents arise from system weaknesses. Section 4. Where the RAF and NHS differ, and the accountability gap. While both organizations share the exact same foundations of psychological safety and system-based investigation, their current day-to-day realities definitely diverge. Now, what's really interesting about this slide is how it visualizes the operational maturity gap. In the RAF, operational maturity is high, accountability is tightly integrated into how they manage occurrences, and the implementation is highly standardized. The NHS, however, has a very strong policy direction, but its operational maturity is still developing. Implementation remains pretty variable because it relies so heavily on local capability, varying local leadership, and local culture. Early experiences with the new PSIRF framework show that while organizations are supportive, their ability to apply it consistently varies widely. To close this gap, there's a fundamental hurdle to overcome. Behavioral accountability absolutely requires a shared language. You need a shared vocabulary to correctly sort and respond to different behaviors. The source material emphasizes that organizations must clearly distinguish between human error, risk-taking behavior, routine rule-breaking, recklessness, and deliberate misconduct. If you don't have a shared vocabulary for all these different types of behavior, there's just no way you can consistently apply a proportionate response, and the culture of trust quickly breaks down. Section 5. Applying lessons to healthcare. The blueprint for the NHS. So how exactly do we bridge that gap? Well, here are the 4 crucial steps the NHS can take based on aviation successes. First, make behavioral boundaries explicit. Staff need to know exactly what behaviors will be supported and what's going to be escalated. Second, visibly connect reporting to learning. Think about it. Staff will only report concerns if they see that doing so actually leads to real, tangible improvement. Third, professionalize investigation capability. This is huge. Investigations must be treated as a professional safety function, requiring actual expertise and dedicated time, not just some administrative chore tacked onto a clinician's already busy day. And fourth, ensure board oversight. Boards must view culture as a critical control mechanism, truly understanding if learning actually led to measurable improvement. Let's move to and see how this builds into an operationalized chain. The RAF's big lesson is that just culture only succeeds when it's disciplined and highly structured. It's a sequence, folks, not magic. Reporting must lead to investigation. Investigation must lead to learning. Learning must result in tangible change. And change must be followed by assurance to make sure the fix actually worked. If any single link in this chain is broken, the just culture fails. But we also have to be realistic about the contextual limits here. The NHS cannot just copy and paste military aviation rules. It doesn't work like that. Healthcare is vastly larger, significantly more complex, and involves multiple different professions and tricky accountability arrangements. Crucially, any framework applied in healthcare must be equitable. It has to be transparent and designed specifically to avoid disproportionate impacts on particular groups of diverse healthcare staff. It has to be fair across the board. Which leaves us with this final vital question to ponder. How do we make this chain of learning visible enough that staff genuinely trust it and patients can clearly see it? That right there is the ultimate challenge for healthcare leaders today. It's the only route from simply learning, not blaming, to a true, robust system of learning with disciplined accountability. Thank you so much for joining me for this explainer. I hope it gave you a powerful new perspective on how we build safety in the systems that matter most.